Thank you, Rod, for that kind introduction and for the invitation to be part of this series. I think it's a wonderful initiative and just an incredible achievement and effort from everybody, maybe especially Dr. Popovic and Ivan for pulling this together. It's a wealth of knowledge that will serve clinicians really well. And in this session, really proud to speak about my contribution to our understanding of hamstring injuries and the work we did while I was in the rehab department at Aspetar and part of the ASPREF team. So very fortunate to do that. Although speaking to you at the moment from rather wintry Dublin in Ireland, where I'm working for the Irish Rugby Football Union, and still very interested in injury prevention and how we best manage our athletes. So it's been a fortunate journey for me, and I'm really proud to share some of the work we did while I was at Aspetar. My Aspetar journey was a very fortunate one, and today, as we've mandated, we're going to talk about what has influenced our clinical practice. I think it's important to maybe just mention first that while I was at Aspetar, I was part of a large team of clinicians, researchers that really made a team effort. So I'm really grateful to all these individuals who contributed to my own personal work and the work we did together. This is an old picture of the rehab department, but certainly probably the one that reflects the best when I was there. The uniforms have changed and the personnel has changed, but it was such a great team and such a privilege to be part of the rehab department, and then also all our colleagues across this National Sports Medicine program, without whom none of this would have been possible. So really grateful that we were able to work together collectively. And, you know, Aspetar is still, I think, one of the leaders in many areas, but certainly around the work we did in muscle injuries. So the two things I'll concentrate on today is that influence my clinical practice is trying to understand what it is we should be paying attention to and answering the question of how we prevent hamstring injuries or what injury prevention looks like in sports medicine. Now, I really like this quote by Mark Twain. Hopefully it is him. We don't know these days, but it's not what you don't know that gets you in trouble. It's what you know for sure that just ain't so. And so how do we know what we know? How are we sure about the information we gather? And a study, and Rod brought this to my attention, that they did in book making, where they looked at accuracy and confidence. So on this matrix, you can see accuracy on the left y-axis and confidence on the right y-axis. So they gave folks different amounts of information. So you can see that when people are given about 5 items of information, their accuracy and their confidence are pretty much the same. But as we give them more information, their accuracy doesn't necessarily improve, but their confidence certainly does. And that's what we're trying to say here. So it's not only about just gathering information, it's also about the quality of the data that you're gathering, the quality of the outcomes that you measure. So more information won't necessarily lead to better decisions, but gathering information that's relevant, that's useful, that's important, and using your own experience, intuition, and judgment will then lead to good decisions when we're thinking of hamstring injuries. Now, this is one of the favorite papers that we've been involved in that Rod authored. It's one of those tough ones because he uses what looks like pretty tricky statistics, but it's not really. And so I'm just going to go through the main messages in this paper, which I think answers that question of what we should pay attention to. So the outcome measure is on the y-axis or the vertical axis here, and the treatment time period. So we did it in deciles, so you'll get 9 or 10 essentially on the x-axis. So what we found with pain is if we ask players to rate their pain, if the pain gets worse, probably should go back a step, right? Pain is still a relatively important outcome measure, but you can see that it normalizes about halfway through. And as Jack will speak about as well, maybe not necessarily not the only factor that should be influencing your decision making, but certainly useful in terms of the overall decision making. When length of palpation pain is half, you're halfway better. So what does that mean? So if we're palpating the area of pain, you can see that this tracks really nicely to about halfway through to the end of the rehab. So as you're measuring the palpation length, you know when you're about halfway through your rehab, or if the palpation length has halved compared to where we started, you're about halfway through your rehab, which is a nice indication of how things are going. If we look at our maximal hip flexion active knee extension test, so this was one of our tests of hamstring or posterior thigh flexibility, it normalizes around 50%. So it's pretty good to use, but halfway through the treatment, it doesn't really tell us much more. So out of all the flexibility measures, this is the one that we found the most useful. And then in terms of strength, our outer range strength was the best measure that tracks reasonably well towards the end of rehab. So it gives you a good indication of how you're progressing. And in our population, at least, normal strength would have been around 50% body weight. And that's probably a fair assessment for most folks, and especially athletes. Maybe our rugby players goes a little bit above that, but in general, that's a nice little guideline to use. The other thing we looked at was the perceived running effort, so compared to their outer range strength. And it looks like there's a rough correlation, not a perfect one, but a rough correlation between their outer range strength and their running effort. So when you're measuring strength, it also gives you a nice little proxy of what the kind of running effort should be. And that's a useful indication when you're not able to treat your patients as often, and especially in these times when we're not able to treat them face to face very often. That's a nice way of understanding how to progress the running compared to their outer range strength. So some of our most useful hamstring assessments just summarized there. Now, these are the things to pay attention to. These are the outcome measures, and it will be different for everybody, but certainly for us, these were useful outcome measures to think about when you're treating, when you're doing rehabilitation of a hamstring injury. So know what to pay attention to. And that's my first kind of takeaway. Measuring clinical outcomes influences our clinical reasoning. And that's really important if you want to provide your athlete with the best possible outcome. So the second thing then is, can we prevent hamstring injuries? So when we think about prevention, we often think about these kinds of things. Masks, cessation of smoking, so just stop smoking, or sunscreen, right? So you're trying to eliminate the exposure. But what would that look like in sport? We can't really do this, right? This is actually a thing. This exists, this kind of bubble football thing. But that would be very difficult to look for elite football playing in these conditions. So in sport, we're looking to win medals, to win cups, to be the best. And the main thing should be the main thing. So the main thing is to keep the main thing the main thing. So in elite sport, we can't think of prevention the same way. We really have to think of it as a risk management process. I think Andy McIntosh and Roald Barr really summarizes that nicely in this 4-step process. So in these 4 steps, we're thinking about injury surveillance as step 1, and that helps you to identify risk for your league and for the team or the individual athlete. Step 2 is a season analysis. What is the season going to look like? And we're definitely exposed to how seasons can change now. So understanding how that might influence injury. Step 3 would be screening athletes, and that's received a lot of attention, right? So periodic health evaluations or screening has got a lot of attention in the research. And then the risk management for the athlete. Do we accept that level of risk, or do we change it? So we could change that into really easy questions. What are the risks for my team? How does that risk change throughout the season? Do certain athletes have a higher or lower risk of injury? And then so what? Should we do something about that? So the work that I was involved in focused mainly around step 3, screening and understanding the risk of injury. Our Aspetar screening battery was quite extensive, and it continues to be. I think it's a wonderful program that has been going for a number of years, and we were able to tap into this collaboration between the football clubs, Aspetar, and the governing bodies to really be able to screen the elite football players in Qatar. And we looked for strength. So this is the normal kind of usual suspects in terms of isokinetic dynamometer, quads and hamstrings, concentric and eccentric, at high and low speed, and then a ratio of that. We looked at flexibility, a passive knee extension test, and a knee to wall test. And we looked for neuromuscular function. So we looked at the timing of the muscle and the rate of force development. And we were able to include some pretty novel devices. Well, at the time, the Nord board is certainly now commercially available, but we were able to include one of the prototypes still in our testing. So really early data in terms of that. So we ended up in over 6 seasons looking at over 800 players, more than 250 injuries, and it ended up being around 4,000 tests. So this is still the largest prospective cohort study that the world has ever seen. So we're really, really proud of this effort. And what did we find? So eccentric and concentric hamstring and quad strength respectively. Yep, so strength is associated with hamstring injury. Ankle range of motion indicating maybe the posterior chain and hamstring flexibility. Yep, flexibility had a small association, significant but small association with hamstring injury. And then torque development and muscle activation, no. So it looks like that might be more affected once the player has been injured. Certainly is still part of an overall holistic treatment of the athlete, but we didn't find an association in our group. So in a very practical way, if we had the hamstring eccentric strength on the x-axis here and the proportion of players, the number of players on the y-axis, you can see that the injured and the uninjured groups completely overlap. So the injured in red and the uninjured in blue. So most of the folks are here in the middle, but whether you're strong or whether you're kind of weak, and you've seen us present this before, it's really hard to identify the individual athlete that will get injured because these groups completely overlap. So it's about clinical utility versus clinical validity. Yes, this is a valid thing. Yes, there is a relationship. But from a clinical point of view, we want to try and help the individual athlete. Now, if we take that knowledge, so there's some importance about strength for reducing injury for the team. We know that we have effective tools, right? The Nordic hamstring exercise has been shown numerous times to be effective, not only in prevention, but also in some markers of performance. So in this systematic review, we just looked at every study we could find, and none of them, even the ones that didn't find a strong relationship, was able to shift the overall effect. So as a rule, until the evidence changes, I think we're pretty comfortable in saying you can include the Nordic hamstring exercise as a team approach to reduce your injuries. But for the player, and this is something that's often missed in this paper we published in 2017, I think there are certain things we can certainly stratify risk, but also we found a really interesting thing around our rehab. Now, this is the timeline for when we started doing screening. And those 2 papers looked at the first 4 seasons on 600 players and the second 2 seasons, or 2 seasons after, and 400 odd players. And we looked at previous injury as a risk factor, as you would expect. And in the first one, we do find it. So, yep, that strong risk factor we always find is there. But in the second one, it kind of disappears. Now, we had to really think hard about this. Qatar is a small geographic location. All the clubs are within our reach. So what happened? Why does this strong risk factor suddenly disappear? And what we realized is we started doing our first randomized controlled trial in 2010, and then the second one around 2013. That's about to be published. Really excited about that. But what happened was, over the course of this time, many of the players, the majority of the players, received either rehab at Aspetar or at their clubs, but following this rehabilitation protocol. Now, that's freely available online if you wanted to have a go and look. But that meant that they were getting really good rehab. So it looks like if we're able to provide our players, our athletes, with a really good rehabilitation process, we might mitigate the risk of previous injury. Now, we didn't specifically test for that, but I think that's a reasonable deduction. And that's a wonderful indication to us. If we do a good job with our rehab, we'll be able to reduce the risk of injury. So Phil Glasgow, who works with us here at the Irish Rugby Football Union, Phil says rehab is training in the presence of injury. And so I like to say, I like to think that an ounce of good rehab is worth a pound of prevention. So our clinical outcomes influences our clinical reasoning, and injury prevention at some level, right, maybe not primary, but certainly at a tertiary level, is actually just good rehab, doing a really good job with our athletes, making sure they get good outcomes when they return to sport. So thank you for your attention. Thank you for the invitation to be part of this session. And I'll hand over to Rod again. Really appreciate this opportunity.